Neighborhood Health Watch is sponsored by the doctors of HCA Virginia.
Stroke is the fifth leading cause of death in the U.S., with one person dying every 4 minutes from stroke. Today in Neighborhood Health Watch, the signs and symptoms. Doctors say 800,000 people each year suffer a stroke. It's a medical emergency that requires treatment as soon as possible to minimize brain damage, which results from the brain not getting enough oxygen. Dr. Thomas Mattingly is director of the Certified Comprehensive Stroke Center at Johnston Willis Hospital. Thanks a lot for joining us today on First at 4. Now, an acronym FAST is probably the best way to recognize symptoms of someone having a stroke. In FAST, we're talking about face drooping, arm weakness, speech difficulty, and T, time to call 911. What happens to the body when a person has a stroke?
So a stroke is a sudden onset of loss of neurologic function. And it's either due to a loss of blood flow to a part of the brain or a rupture of a blood vessel.
When we hear one person dying every 4 minutes from stroke, it sounds like the survival rate is really very, very low. I would imagine that it is important which center, which hospital a person goes to for treatment.
That's correct. Those centers that provide a whole range of options, and there are a number of options now in treatments, all of which are time dependent, that really does determine how a patient can do, and we have good evidence for that now.
And Johnston Willis just got certification last week, I think you mentioned. This is really great news for the area.
Yes. We are the second comprehensive stroke center in Virginia. We're the first community hospital to have this certification. And basically this speaks to the coordination efforts on a part of a multidisciplinary team to rapidly act, diagnose, and institute treatments as they according to what the patient has been found to have.
And quickly, what are some of the habits people should change in order not to become a stroke patient?
So the big ones are cigarette smoking, addressing high blood pressure, and addressing high cholesterol if that happens to be found.
All right, Dr. Mattingly, thank you so much for joining us.
Thank you for having me.